welcome to Digital Health News. We are here at the CII Digital Health Summit 2024. Now imagine healthcare is a profession that requires a specific human touch. But what if you get that human touch with a droid and the technical capabilities of it? Well, that is what we are here to see with RIA. RIA is a humanoid. It's a human plus droid, a humanoid, which can answer your queries, which can answer your healthcare queries, developed by Machani Robotics, based out of Bangalore. So let's have a word with RIA and understand what RIA can do and understand her technical capabilities as well. That's one revolutionary concept, because this is first time in India that such a humanoid robot has been presented here at the CII Digital Health Summit. Let's talk to RIA and understand. Hi RIA, it's great to meet you. Hi Ria, it's great to meet you.
It's wonderful to meet you here at the CII Digital Health Summit. I hope you're enjoying the convergence of technology in healthcare as much as I am.
Absolutely, Ria. I have a question for you. What is it that can you do?
Hello. As a humanoid, I can perform tasks like human interaction, data collection, and provide assistance with technology. My design allows me to aid in healthcare settings, offer information, and assist with patient care. How can I assist you today?
If I ask you a question related to my health, would you be able to answer it?
Certainly. I'm equipped to provide general information on health-related topics. However, for personal medical advice, it's always best to consult with a healthcare professional. How can I assist you today?
Absolutely. Ria, it is raining heavily in Bombay. I stay in Bombay and the flu is going around, viral flu is going around. What would you suggest? How would I take care of my health?
Navigating through the rainy seasons can indeed be tricky. For the viral flu going around, I'd say prioritizing good hygiene is key. Wash your hands frequently, avoid close contact with anyone who's ill, and stay up to date with flu vaccinations. Also, drinking warm beverages and ensuring adequate rest could help bolster your immune system. If symptoms persist, a chat with a healthcare provider is always a smart move.
Absolutely. Thank you. Thank you so much, Ria. Thank you so much for your assistance.
You're welcome. Take care and stay healthy. If there's anything else you need, don't hesitate to ask. Have a great day.
Thank you. So we just saw how impressive Ria is. Now we have with us Mr. Rahul Chatterjee, Senior Director of the Special Projects at Machani Group, who is the developer of this fantastic, a humanoid. Sir, first of all, tell us, how did this idea come about?
So this idea is based out of the basic mission to improve quality of life. So when it was conceived, the creators of RIA decided to have a social companion bot which was positioned at high value and addressing the emotional needs. Just to give you a context, a robot could be a physical robot or an emotional robot. Within physical, it can be low value or high value tasks. For example, a physical low value task would be a robot which is used for painting. A physical high value task would be something which you use for a knee replacement surgery. But we position RIA in the emotional area and to go after extremely high value tasks. So what I mean is address the problem of loneliness, address the problem of companionship, look at the issues which impact longevity of the people. Our idea was to create a bot, a humanoid, which is able to impact healthcare in a big way wherever there is a severe shortage of staff. So we are looking at certain use cases in the elderly care, in healthcare facilities, in long-term care facilities, and multiple use cases to do with mental health assessment.
Absolutely. Thank you so much for that. What are the technical capabilities that are inbuilt in RIA? Because I can see there is a camera here. She can also understand the language that I'm speaking in. So, what are the technical capabilities that are integrated?
So that's a great question. I think we basically plan RIA to be multimodal and with duplexity. I'll just take a minute to explain that. So, when I talk of multimodality, I mean RIA should be able to accept inputs in terms of speech, in text, as a video, that is, she can see. She should also be able to give an output in terms of speech. Eventually, RIA would have gestures, emotions, expressions, all of which would contribute to multimodality. There are other ways to increase the multimodality. We could have sensors, multiple sensors. RIA would be able to gauge your body temperature. Through her ability to record what is happening, RIA can recognize change in your cognitive abilities. By duplexity, what we refer to is RIA's ability to have a natural conversation with you, be able to figure out when to interrupt you, when to barge in, when to come in, what we refer to as turn taking. Because, as I told you earlier, we are positioning RIA as a conversation robot capable of being a companion to address the issues of companionship, longevity, loneliness. So these are some of the capabilities. We never see RIA as a robot which is going to be lifting weights or doing somersaults, but we are positioning RIA mainly in the emotional, mental health, to be able to assess your mental condition, whether you are going to get a panic attack, address your issues of depression, do a mental health assessment, cognitive abilities. Those are the areas we are positioning RIA for.
Absolutely. Thank you so much for that. Again, as I asked, what are the technical capabilities that are built in? If you could touch upon that, the camera and the voice recognition, speech recognition, and all of that.
Yeah, so RIA has inbuilt cameras. She has inbuilt speakers. I believe she has multiple sensors. RIA is a platform. So if you have very exciting use cases, for example, we recently integrated RIA with an app which is able to recognize your movements, do a gait analysis, and able to recommend to you physical exercises and physiotherapy to change your posture and address your body pain. So those are platforms that we can integrate with RIA. But today she has speech recognition. She recognizes the physical features. She recognizes objects. She is able to process text to speech, and vice versa. And going ahead, we would continue to keep on adding more and more capabilities to RIA so that she becomes absolutely multimodal.
Absolutely.
Okay, thanks for pointing out, Suchit. The other area which we are looking at is, we have integrated RIA with Mobius Mobility's iBot, which means RIA would be capable of motion. So this version, the one which we have now, doesn't have that, but we have already done this, integrating RIA with mobility.
Absolutely, that's fantastic. One last question for you is RIA is powered by ChatGPT, if I'm not wrong. How do you think she can improve further? Because ChatGPT also has its own limitation. How do you think RIA can be able to improve further?
So while today RIA is integrated with ChatGPT, we are open to using other LLMs. So our intention would be to use whatever is most relevant and whatever is most current. The way we work with RIA is, other than the ChatGPT, we provide RIA a context. So for example, if we are positioning RIA in a medical school to teach doctors empathy or role playing in a highly immersive experience, we would give RIA a context that, RIA, you are a diabetic patient and doctors are going to come and do a examination. They're going to come up with their diagnosis and give you feedback. So we have to give RIA a context based on the use case. And we also give RIA the guardrails, that is the boundaries within which she operates. Other than that, she doesn't need too much directions.
Absolutely. Thank you so much. This is one fantastic demo that we have had today. And I believe that RIA will also be now integrated in many hospitals. And as you rightly said, for an emotional companion, RIA would be great for elderly care and other such areas. Thank you so much, sir.
Thanks a lot.